Assalamu alaikum, ladies and gentlemen, aspiring students and fellow healthcare professionals. I am Sana Askar, resident pharmacist at Shifa International Hospital. I have the honor of moderating today's session, and it's my pleasure to welcome you all to today's QA session on the topic Board Certification in Pharmacy, Paving the Way to Professional Growth. We have the privilege of having a renowned speaker with us today, but before revealing his name, I would like to introduce him. He has done PharmD from Hamdard University, Islamabad campus, MS in Biostatistics from Comsets University. He is one of the few individuals in Pakistan with the privilege of having board certification in pharmacotherapy. He is the only pharmacist, or I must say the pioneer, who has the distinction of having board certification in infectious diseases in Pakistan. He currently serves as the assistant manager of clinical pharmacy at Shifa International Hospitals, assistant professor at Shifa Tamir Millat University, and also he is the youngest ASHP residency program director. Please join me in extending a very warm welcome to none other than Mr. Rehan Anjum. How are you, sir?
I'm fine. Am I audible?
Yes, sir, you're audible. Sir, we are very pleased to have you here today. Our dear participants are very eager to learn from your experience. The pursuit of professional growth is of paramount importance in our field, and board certification plays a significant role in advancing our knowledge and skills. So, sir, please enlighten us.
Thank you, everyone, for joining this session, and thank you, Sana, for such a nice introduction. So, as I have been introduced very well, but as Ms. Sana said, that there are very few board-certified pharmacists in Pakistan. So this is the point that where the pharmacy profession should prosper in the country. So most common question I come across, sir, what is the board certification, how to do it, what are the hurdles? So I thought that while answering everyone individually, why not to have a session and give a chance to everyone to answer, to ask questions, to interact, and if I could help someone to pursue this board certification, so should I. So today's session would be like that. We have identified some kind of questions for the session, and we will try to answer those questions in the brief presentation, and after that you would be allowed to ask questions, and we will try to answer those questions. So let's start our presentation that I just passed the BCPS exam. This is what you want to achieve. So these are some of the questions. What are the requirements for applying for the board of pharmacy specialties, or how do I determine which specialty area is best for me? Or what are the prerequisite qualifications? What are the application process? How is the scoring is done? How to prepare? And what kind of resources? And there are a lot of things. And I think so we will try to cover all these one by one in the presentation as well. But if there is something left in the presentation, you can ask in them. So starting about the board certifications, if you talk about the board certification, what are the board certification? When we are in the institutes while we are pursuing the PharmD degrees, we just came to know that there only MPhil program is left for us. And after doing the MPhil program, we are still confused what to do or what to not. So as the world is moving on towards the specialty, so for the pharmacist, there is a board, that is the American Board of Pharmacy Specialties, that credentials a pharmacist that you are a one who is specialized in specific type of pharmacy. No, pharmacy is not just close up on the PharmD degree. After that, this is a degree that is this is a certification, and as I'm saying that it's a degree as well. But in some countries, like in Egypt, the the BCPS exam, the board certification exam, is considered equivalent to the MPhil program as well. So because there are a lot of pharmacists pursuing these kind of certifications. So these are the voluntary certifications, and this is the certification that ensures that you are competent enough to provide specialized patient care. For example, if it could be a critical care pharmacist, if it could be infectious disease pharmacist, if it could be someone general medicine, solid organ transplant. So This is actually a credentials provided by a prestigious institute that is Mode of Pharmacy Specialties, and it is in accordance with American College of Clinical Pharmacy. So it is one of the gold standard certifications for the pharmacist to pursue after the PharmD. And in the session, I will tell you that what kind of the opportunities are available or what are the prerequisites for the session as well. So starting with the what are the benefits, we will talk that what would be the benefit of having a board certification. First of all, advancement in professional development, as there are very few board certified pharmacists and it's an era of specialization. So having a board certification will help you to advance your career. It could also help you to advance your growth in the organization. It would help you to have more specialized knowledge. For example, you would be more able to work closely with the physicians, with the nursing team, and you have more practicality aspect of your knowledge. So there would be expanded career opportunities. If you see, many of us are applying for UAE, Abu Dhabi, etc., and we can see that there are people. If you can see, there are three types of specialties: that pharmacist, clinical pharmacist, and pharmacy specialist. So the pharmacy specialist is the one who holds a board certification. So and moreover, in Pakistan, as this is the developing thing, there are many people who are going through it and pursuing this, and increased learning potential, earning potential and learning potential both. So as the it's a very paid kind of certification, but when you pursue this, obviously it help in advancement of your professional development, and it also provide you some kind of monetary benefit. Like, for example, if you're working at Shifa or some other institutes, they have incentivized the board certified pharmacist with some other benefits as well. So it help you. Moreover, it enhanced patient care. Trust me, it is one of the best learning I ever had in my life. So when you go through this board certification, you will come to know the practicality of the knowledge, how to implement the knowledge, how to perform an appropriate role of the pharmacist. What is the exact role of the clinical pharmacist? So it will help you to provide more better patient care. And obviously, in industry also prefer now a board certification as well. Moreover, it's as it is the gold standard certification in the pharmacy, so it has a very good recognition and prestige as well. Moreover, you will have a chance to have a networking and collaboration opportunities. And moreover, the best thing is that you would be involved in continuous education and professional development for the maintenance of this board certification. So these were some of the benefits of the board certifications. So let me make it easy for you about the BCPS. Like as the physicians are going for the fellow of FCPS like things. So actually BCPS is a board certification that is a certification. FCPS is considered equal to the postgrad education. But right now BCPS is not considered a postgrad education, but it is an advanced level of education, advanced level of training for the pharmacist. Okay. So when we talk about the board certified pharmacist, there are about 55,000 board certified pharmacists in the world, and most of the board certified pharmacists are board certified pharmacotherapy specialists. And there are multiple type of board certification available in different specialties. For example, board certified pharmacotherapy specialist is the one you can see in the general specialized in general medicine. BCPP is a board certified in pediatric pharmacy, then board certified in critical care pharmacy, infectious diseases pharmacy, transplant pharmacy, sterile and compounding pharmacy services, ambulatory care services, geriatric pharmacy, and nutrition support pharmacy, and nuclear pharmacy, oncology pharmacy. So these are some kind of the certification, and as you can see from this chart, that most of the people are going for the board certified in pharmacotherapy specialist, and other one are board certified ambulatory care pharmacists. So this is a chart that shows the distribution of the board certified pharmacotherapy specialist. And the answer of a question that which specialty should I go for, this depends upon what kind of experience you are, in what kind of learning experience you are working. For example, if you're working in an ambulatory care, then you shouldn't go for something like critical care or oncology. But if you're working in an oncology setup and you have daily interaction with oncology patients, so you should go for BCOP. So this is one of the questions. If you talk about Pakistan, Pakistan really needs a lot of improvement. There are just 15 board certified pharmacists, and I think so there are just hardly 6 to 7 board certified pharmacists that are located in Pakistan. Most of them are abroad and working in different organizations, and there are also multiple board certifications as well. So total 15 board certifications are available in Pakistan, and you can see the detail of a board certified pharmacist, the credentials of a board certified pharmacist from the BPS website, that Board of Pharmacy Specialties. This is the website. You can go there and you can find any board certified pharmacist or the resources for the board certification. And first of all, the question is that am I eligible for the board certification? How I would be eligible. The thing is that you must be a Form D graduate, either it is from America or from international. For example, you are from Pakistan, or etc. You must have to be licensed to practice in the area, either it is Pakistan and thing. The other thing is the relevant experience. There are different experience requirement for to apply for the board certification. At least the requirement is of 3 years. So if you have experience of at least 3 years, you will be able to apply for the board certification. But in some kind of specialties, for example, in infectious disease pharmacy, you are required to have an experience of 4 years. So these are the requirements. But there are some kind of good things that now in Pakistan, there are some ASHP accredited residency programs are there from the Shifa International Hospital, Shaukat Khanam Hospital, Aga Khan. So the person who had completed this residency program are also eligible to apply for the board certification exam as well. So how often the exam is conducted? Usually the exam is conducted twice an year. That is an April-May window, and the other is August-September window. So you have to get yourself registered on the website, and then you have to book your exam dates. So usually the exams are conducted twice a year, but now BPS is also conducting the sessions that is continuous testing, that is irrespective of these examination windows. You can go for that. You can visit the website to check that which kind of board certification are in continuous testing phase. So for the application, first you have to make your ID at the BPS website, and that portal you will create your ID. And when you will create your ID, your credentials, that BPS will have your credential, will have your portal. In that portal, you have your all information related to your education, your experiences, and the relevant document, etc. You have to there. After that, you have to submit multiple kind of documentation. That documentation are related to the related to your experiences. For example, your work experience, and you have to provide an experience letter from your employer that you had the required experience as per the requirements of the specialty. For example, if it is an ID pharmacy, then you must have the appropriate amount of time spent in the ID activities. So this kind of document has to be uploaded. Then usually the application takes up to 20 business days to process, and you also have to provide your university transcript. And this is something that has been asked multiple times, that how to do for the university transcript. Previously it was like that they asked the university to please send us the transcript of the candidate directly to the BPS, Board of Pharmacy Specialties. But now the good thing is that you can write some representative name or the email address, so they can verify your credentials, your degree, etc. from the university as well. So that forms are available on the website. So when you complete your documentation, your profile, then you have to schedule the exam. For scheduling the exam, you have to pay the fee. The fee of this program is $600. That makes around about 180, 190,000 in Pakistan. So for the first time, it is $600, and if unfortunately you couldn't make it, for the retakes, you have to go for the half of the fee. And it is when you are retaking the exam in an year. For example, if you appeared in April-May window, and you will be eligible to apply in next April-May window at $300 rate, but after next year you would not be eligible for $300. So it is a $600 fee for the exams. So when you do it, then you would be authorized to take the test, and then that is also available at your portal at the BPS, or you can also get the email. So when you're authorized to test, and then you can select the centers. For example, there are centers in Pakistan, in Islamabad, Lahore, Karachi. These are the center, and the exam is to be taken via prometric exams, prometric exam centers. So the main point is that, again, many people who are working as a hospital pharmacist, they are asking about how to prepare for the exam. Now, this is something very critical. We have certain things to learn. We have to make up multiple things, because the PharmD degree is just a baseline degree. After that, you have to increase your education. So you have to go for the board certification exams. So for that, the program content have different kind of modules or specialties. Like, for example, there would be patient care, there would be research methodology or communication, etc. But trust me, that is worthy to read. Either you are going for the certification exam or not, or if you're not eligible. For example, if you're a student and you're not eligible to go for the exam, but I will surely recommend you to please go through the exam content. That exam content could be shared with you. I will try to share the content, the exam content, via email to the attendees as well. In the end, I will see that how many participants we have. So we will share the resources with you as well. And that resources are from the American College of Clinical Pharmacy. So and then you have to set up a plan for the exam. The board of pharmacy specialty exam is just not like other exams, like you are looking for UAE, HAD, etc., or the other exams. It is specialized exams, and it is very something that they critically made that exam, and they test one person again and again. So one has to read it. So you must make sure. My suggestion is that at least you have to go to, when you're applying for an exam, at least you once have completely go through the content of the exam, and those books are available. And another thing is, the best thing is that whatever you have learned, you have to practice it. For example, if I'm working in ambulatory care, like in a retail pharmacy, and then if I read something, that I come to know that ARBs or ARB, if ACE and ARB have angioedema potential of 1%, then I came to know that if a patient is going through this, then I should make an intervention, or etc. like that. So whatever you have learned, you have to practice this. The best thing is you must be practicing in that domain as well. So this is for the exam. And for the exam day, usually the exam day is it's an online test conducted in Pakistan. And for the exam, there are two parts. Previously, it has been changed. Previously, when I was there, it was conducted in two sessions. That is 100 question in the part one. Then there is an optional 30 minutes break, and then again 75 question for next 2 hours. But now the exam has been changed to 150, so it has been changed now. So 150 questions would be there, not 175. My suggestions for the exam, I would say that it's a quite lengthy exam, and the best thing to pass that exam is to maintain your focus, because your brain would be tested again and again. So it's very hard to have a focus on the screens. You may lose temperament, you may feel demotivated, or rejoiced, or you might be excited that oh, that's quite good, I can do it. But obviously it's a 3 to 4 hours exam, so you have to you have to make it. So you have to be focused. You try to take examples from that. There are multiple options in the exam window. You must stay calm. It is not necessary that you know each and every questions. There are very difficult questions as well. But you have the option always mark a question. You can flag an option. Flagging an option a question mean that you flag a question. In the end, if you got enough time, then you can go for the review as well. There on the computer screen, there's a calculator option available, and for the different domains, there would be different question. For example, from research, there would be questions from patient care, question from the ID, etc. So there are mixed questions. It is not that okay, this is the stats portion, this is the pharmacotherapy portion. This is not like that. And you must stay focused, and usually there wouldn't be any long statements. For example, in my exams of 175 questions, there are hardly 3 to 4 questions where I have to scroll down to get the full screen. Usually the labs values are shown there, or some kind of hint is there always. And I think so you must be smart enough to pick out to catch that point. What's the right, for example. And about the results, if we can say about the results, the scores will range from a minimum of 200 to a maximum of 800. And for that, the passing score is 500. That is a comparative marking, and that's a separate marking system adopted by BPS. So you have to score at least 500. So if you score 500, that's great, and that would be so relaxing, and obviously that's an achievement. But unfortunately, if you're not going to score that, then you have to apply again. Usually the result, it's not that you have complete the test, you will get the result. The result would be there available after 60 days of the closing of the window. For example, if your test was on 5th of July, for example, 5th of May, and the exam window would be closed on 20th May, then it would be 60 days from the 20th May. So when you gone through the exam, you qualified it, then you would get the certificate as well as these badges. These are my badges as well, and you can take the exam within 1 year, and there could be unlimited attempts you can go for that. For example, it's not for 1 time, 2nd time, 3rd time, 4th time, but I would say that one who is in the process surely will get it, though it's a hard one. Though we had multiple challenges, but the persistence can do it, and will do it, surely do it for you as well. So this was all about the guideline for application for the BCPS exam. So this was brief. I explained about that, what is the eligibility criteria, how to apply, how to prepare, scoring, etc. So now you are open for question answer, any kind of question answers. You would be asked, I would answer those questions. Ms. Sana, I can read those questions directly as well. So if any one of you have questions, please write in the question answer section so that I can answer that.
Very well explained. Sir, what is the, are there any prerequisites or qualifications needed to be eligible for this specialty?
Yes, for eligibility, the thing is that you must have at least, mostly we are PharmD graduates, we are licensed, but the main thing is that you must have the relevant experience. So we must have the relevant experience to apply for the exam. I get a question. I got a question there from where we could prepare for the exams. So for the exams, I would say that the course content is available from American College of Clinical Pharmacy. I will share it with you in what type of board certification you are going to apply. Usually these are paid, but in Pakistan, we should support each other as well.
Okay, how do I determine which specialty area is best fit for me?
For the specialty area, as I have told you that it depends upon the area in which you are practicing. For example, there is also a question that retail or community pharmacy are eligible for any certification. Yes, retail or community pharmacists are eligible for this certification as well. And as the question says, I think it is from Sayyid of the Hussain Shah that if you're working in the retail or community pharmacist, then I would recommend you to go for the board certification in ambulatory care pharmacy. So you shouldn't apply for the critical care pharmacy or the oncology pharmacy. So you should go for this one. Uh, Again, I would say there is a question, will we receive certificate at the end of the session? As this is the general information session, this is not a continuous education. So the certificate wouldn't be issued to anyone for this session, because it is the general information session, is a career constant session. It's not a continuous education session. So I have closed it. Next is kindly brief us about BCID relevant experiences in years. The BCID experience is 4 years, but I just want to say one thing, that for the board certification exams, they equip you with so much knowledge that you would be confident in making any kind of interventions or etc. So I think so one must go through these things. And there are multiple questions being asked in the chat box. I would say if you could ask those questions in the question answers box, so that we can answer them there. So can we directly apply for BCPS after residency without 3 years of experience? Yes. If you have done an ASHP accredited residency program, then you can be eligible for BCPS. But for the specialties, for example, BCID, you must have to complete the 1-year residency program, and also 1 year of the post-residency experience as well. Sir, we apply for secretary specialist pharmacist. Yes, I'm not sure about whether there is a board certification in psychiatry. I have to look for it. I think so. There was a specialty related to the psychiatry as well. Okay, can you suggest some preparation, content and criteria, or books, etc.? As I have told you, that content is just the American College of Clinical Pharmacy books or booklets that is available. But the good thing, I would say that I highly recommend that if you could learn it from other resources. For example, if there are guidelines available, or in your daily practice you come to know, or in your daily practice you go through. For example, if you learn about how to use vancomycin dosing in critical care patients, so these things also help for you. But I think so American College of Clinical Pharmacy books are well enough for the exam. What kind of books are you recommending for the BCPS? I have answered that question. Okay, sir, can you tell about other tests which would be useful for jobs in abroad? So I think so for jobs in abroad, one must be competent enough. He must have appropriate eligibility as well. So there could be multiple for board certification exams. There could be multiple diplomas. There could be certification from prestigious institute, for example, ASHP certification in anticoagulation, oncology certificates, ISOPs. There are multiple ways where experience that could be helpful in finding the job or making the career. So which subject we should focus more during the Form D? In the Form D, I would say that you should focus on all the subjects, because wherever you are, whether it's industry, it's marketing, it's hospital, wherever you are, and all those topics, all those subjects are interlinked. For example, if I am a clinical pharmacist, then I must know the formulation of the drug as well, that how drug will behave, how if I have to compound something, I have to make some kind of composition. If I have to go for the order of TPN, etc., then I might go for, I might need help of the physical pharmacy. So I say that which subject we should focus most during the Form D. During the Form D, I would say it's the all subject, but after Form D, it should be the one. For example, if you are going to be someone who want to excel in industry, and you are applying for the BCPS, that will not make sense. So and that would be according to your interest.
So are there any mentorship or preceptorship programs available for individuals pursuing this specialty?
Currently, in Pakistan, there are not any mentorship programs or the training programs for the BCPS. Yes, there are some sort of video lectures that has been done by different organizations for the board certification exams. But I don't know how much effective they are, or what kind of, whether they are giving a specialized coaching to the participants. I don't think so that specific kind of coaching is provided. But when we would be a lot of pharmacists in Pakistan, we should support each other. We should there should be direct mentoring for this program. In Egypt, there is a lot of mentoring for the board certifications. But currently in Pakistan, no, not as such. But there are lectures of BCPS. You can Google it and you can find it.
Okay, are there any specific regulations or legal considerations that you think that applicants should be aware of in this specialty?
For example, in different kind of specialties in BCPS, actually these are the American certifications related to the America, or according to the standards of America that sets the standards. So there are some kind of regulatory part is there that describe that how medications would be ordered, what are the patient health information standards or rights of the patients, how patient could console, or that could detail about the risk mitigation strategies or REMS programs. So some kind of legal part is there in the course content, but believe me, in my exams, I hardly have any question from those part. But yes, in the exam content, there are some legal chapters as well.
So are there any grants, scholarships, or financial support options available for individuals pursuing this specialty?
Yes, this is a good question that there's a grants or not. Actually, there isn't any grant available, specific grant available for the boards, grant given by the BPS or someone else. But usually the organizations, for example, at Shifa International Hospital, what we have in that our board certification incentivized that if you are going to do it, then you would be provided an amount that might help you to recover those amount. But obviously, I would say that the people who are at those stage to support continuous learning, they should have some kind of grants. But internationally, neither BPS or not anyone else is supporting or having any kind of grants.
Okay, what are the potential pathways for advancement or specialization within this specialty?
For example, if you're a BCID, I'm a BCID. So if you're a BCID, then what is that? When you're in the antimicrobial stewardship program committee, then your credentials are high. Whatever you are saying, that would be a knowledge base that is up to date. So your value is increased. But moreover, the profession developing the collaborative drug therapy treatment management program that could be initiated, a specialized pharmacist presence in a specialty help the organization, and will also lead to the recognition of the pharmacist in that area as well. Benefits of being BCPS, I have discussed it, and it's going on to be discussed along with. I am working as a diabetes educator at endocrinology ward. My working as like a clinical, will I be eligible for BCPS exam? Yes. I think so. You would be eligible for the BCPS exam. Just check the eligibility pattern, and I think so. If you have 3 years of experience, you would be eligible. Can an IPD pharmacist apply for this certification? Yes, IPD pharmacist can apply for the board certification. As I have told you, that there are multiple types of certification. For example, board certification in pharmacotherapy specialist. The pharmacotherapy specialist is the one that could be from the ambulatory care, that could be from the IPD. For the IPD pharmacist, I would say BCID is BCPS is the best, and for the ambulatory care, for the OPD, I would say ambulatory care is the best. Is it lifetime achievement for us, or we have to renew this certification? A very good question. It is not a lifetime achievement, because it is knowledge, not something that you have done it and now you just sit and relax. For the board certification, there are two ways: that either you involve in continuous professional development, and that continuous professional development is provided by the BCPS. There are multiple learnings and evaluation material provided by the BCPS. Either you have to go it and you have to 100 CERs from those contents, and that is update content. If you are going to, if you have achieved that, then your board certification will be extended for next 7 years. It's every board certification is for 7 years. After 7 years, it has to be renewed. Or the other way is that you have to again give a recertification exam, and that exam is usually 100 questions in the exams.
So how does board certification contributes to recognition within the pharmacy profession and among other healthcare professionals?
As I have told you, that it's a specialized specialist pharmacist. So whenever you have knowledge, you can make a better intervention. For example, I still remember that when I was on the wards after board certification exams, there was a lot of improvement, a lot of interventions by me, and that is well taken up by the consultant as well. So it's a good example that I think so. Board certified has enough knowledge. That's the thing that make him well recognized in the department as well.
How does achieving board certification positively influence the quality of care pharmacists provide to their patients?
As I had told you that for quality of care has been improved. For example, you have a better knowledge. And you can know better about the use of the medication. So you can make an intervention in the pharmacotherapy plan of the patient, like what kind of medications has to be used, what is the contraindication, what is best for the patient. So a patient will receive the best patient care. Is it or not, or he's eligible for BCPS? There are multiple questions. I would say I would skip them that related to that whether I am eligible. My point is, if you're working in the hospital setting or in the ambulatory care setting or in any pharmacy settings, you are eligible for the board certifications. For example, if you're working in oncology pharmacy, then you should go for the oncology thing. You can apply for the ID thing or etc. if you have the relevant experience as well. But I would say you must apply in the specialty where you are working.
So is there any special considerations or accommodations for individuals with disabilities?
Yes, and these accommodations have been provided in America, but I don't think so that are provided in Pakistan. But BCPS says that accommodation is provided for any disabled person or anyone like this.
Yes, please.
Which subject we need to focus more from starting to qualify this exam? This is something that we should focus, that BCPS exam or BCID exam whatsoever. One of thing that I have noticed that in Pakistan, we are involved in pharmacotherapy of the drugs. We know how drugs work, but we are usually lagging in the research field. For example, we don't know what kind of research it is, what is translation research, what is prospective, what is retrospective, these kind of research questions. And the two chapters that also make a competency in the exam, and that is research and biostatics. I think so that should be done. That's not so extensive, but that's quite easy. If there is someone who can guide you, he can teach you in just 2 to 3 hours. But I assure you that if you are good in research and board certification, obviously that will give you confidence, and obviously that will help you to achieve that thing. Working as assistant manager pharmacy, not directly in clinical activities. Either I should pursue for board certification. I think so. If you are working as a assistant manager pharmacy, there must be some kind of connection with the pharmacy. For example, there must be some kind of reviewing, for example, for any kind of guideline, any protocol, or any medication management process. So if you could check the content, eligibility content, for example, for the BCPS, I would say, or ambulatory care, you might meet the criteria. So I think so. Board certification, one should go for the board certification. Either for the students as well, there would be multiple students who are not eligible for apply. But I say, if you want to increase your knowledge for the clinical pharmacist, you should go for it. Is there any board certification available for administrative pharmacy services? Yes, for administrative board pharmacy therapy services, there are MTM programs that are also available.
So if I talk about Pakistan, what privilege does BPS have over non-BPS in Pakistan?
Obviously, for the BPS exam, for very few people are the BPS. So first of all, there is a monetary benefit. But moreover, if you have recently viewed multiple job advertisements, you can see that they have categorically mentioned that we are looking for someone who is board certified. So you can get a chance to apply for those certificate, those position, and have a better position to achieve that. Moreover, also there is a enhancement of your job position. For example, my role has been enhanced, or I got a promotion after this exam as well. So these are some kind of activities.
What happens if my application is not approved? Is there any appeal process?
Usually, it does not happen. They usually say that what kind of issues is with your application. Usually, it doesn't happen. But if there's a problem, yes, you can go for it. There are multiple type of appeals you can do. For example, you can change your dates as well, but that are paid. You can go for exam paper rechecking, but I wouldn't recommend you to go for that, because that is automated system to check the mark sheets, etc. So I wouldn't recommend you to go for that. Will we be able to practice abroad based on BPS certification? Actually, BPS certification is an advanced certification, but to practice in an area, for example, if you are talking about America, etc., then obviously their baseline test, for example, I think so that is FPGE and NAPLEX, you have to do that. And after that, surely board certification will surely help you. For example, if someone is getting $20 to $30 per hour, then you would be at $40 to $50 per hour. Surely it would help you, or also in UAE, etc. What advice would you give to young pharmacists who look up to you as an inspiration? My advice is always that seek knowledge. You must seek knowledge. It's not necessary that certification, you must be board certified, but you must be a pharmacist who is knowledgeable. That a doctor would say that I need this pharmacist. A patient say that I need this pharmacist, or how exceptional he is. So I would say that you must involve yourself in continuous learning. So involve yourself in continuous learning and enhance your knowledge and competency.
Are there any prerequisites or qualifications needed to be eligible for the specialty, or what privilege does ASHP residents have?
ASHP residents have the privilege that obviously they don't need a 3 years experience. So after ASHP residency, they can directly apply for the board certifications. There was a question that please share slides where schedule of annual twice-yearly test schedule was given, and that was taken up from the BPS website. If you could go there, you can find that the exam windows or the registration windows there. So please tell about the caps. I don't know about the caps. So yes, we have to renew the certification. It has been asked whether we have to renew the certification. Yes, we have to renew the certification. If we are working in industry, then which option should we opt in BPS, pharma industry? I don't think so. There's an option for the board certification in industry, etc. Or I am not aware of it, so I can't say anything. Okay.
Sir, here's a question for you. Tell us about your hurdles and obstacles that you faced during your time.
Oh, that's something that you must know. Everyone who is going to apply for the BCPS exam, you must keep it in mind that it's for me, it's one of the toughest exam I ever had, and it asked me a lot of dedication. And one thing I categorically say, and I am openly say that I failed it twice. I failed it twice, but this does not mean that I should quit. And I passed it in the third attempt. So the thing is, it asks a lot of dedication, a lot of hard work, and a lot of hard work and sacrifices. You must be persistent, because you have to keep on enhancing knowledge. You have to self-evaluate yourself. So I would say that it is one of the toughest thing for me, because it took a lot of time for me. There was a very hard schedule for me for reading these things, because it might up to 16 to 18 hours a day reading for me for these exam. And then practicing those things in the hospitals, that helped me a lot. For example, for the BCPS, it was my third time that I passed BCPS, but for BCID, it was my first attempt and I passed that BCID. There was again question that can we have more than one BPS certification? Yes, we can have more than one certifications. For my BCID thing, for my BCID thing, because I was practicing in that field, so that helped me a lot in answering those questions.
After doing board certification, can we provide consultation to patients?
After doing board certification, can we provide consultation? As per the law, patient counseling is allowed to us, but I couldn't get it properly, whether if you're looking like if you want to go for the prescription of the drugs, so that's not allowed for us. But yes, you can go for the CDTM kind of work, that is collaborative drug therapy management work, in which you can discuss with consultant, and you can have some kind of role. For example, you could help in de-escalation of antibiotics, etc., or anticoagulants. So that could be done, but having an individual practice, it's against the law and shouldn't be done. Sir, is this a global certification or its validity is for certain countries only? If we pass this exam, we'll be eligible to practice anywhere in the world. Actually, this is not the basic exam. As I have told you that this is not an exam that you can say that I have passed it, no, I can work anywhere. This is an advanced level exams that shows that you have exceptionally good career or exceptionally good knowledge, etc. But to practice in the country, you must pass that basic exam that has to be passed by everyone. And so based upon the BCPS, you're not eligible to practice anywhere in the world, but obviously that will help you to achieve a good job or good position in an organization.
BCPS is now in continuous window or in windowed schedule after current changes in BPS.
For the continuous window, there are some few certifications. Previously, it was that BCPS was offered twice and in a year, but now there are multiple certifications that has been offered throughout the year. For example, at any time you can register and can have your exam. But previously, it is that you have to, for example, you have to register for this window. For 4th August is the last date for the application, and after 4th day, you would not be eligible to schedule your exam. And for scheduling of the exam, there was a fixed date that you have to schedule between this date to this date, but for the continuous window testing, you have to schedule within an year. So that's a good thing. Pharmacist who is working in BCPS or OPD or IPD, I would say you to go through the exam content. For example, if you are working in OPD and you haven't knowledge about the critical care thing or infectious disease or something like that, so that might be difficult for you if you're good enough in memorizing. Then that's good, but the questions there in the BCPS are not the pet one that okay, 2 plus 3 is equal to 5. Those you don't expect such questions there. They surely I really appreciate the paper making tactics of them, that they know that who is more knowledgeable, etc. How many chances are there to pass the exams? Unlimited chances. So you can apply 3 times, 4 times, 5 times. I have seen a person who passed it in the 9th attempt. So you can apply it as many times as you like. So for preparation for exam, which subject should we focus? Obviously, it's for the clinical pharmacy. So you have to focus for the clinical pharmacy things like pharmacology. And in pharmacology, there is also biopharmaceutics, everything that is related to the patient care. For example, biopharmaceutics is also their research, patient ethics that could be there, and that are mentioned in the BPS guide as well. Are books available online for preparatory for specialty? We are to apply. Yes, these books are available. You can read those. You can get those. If you're not able to get those, then I will say that you can email me. I will share my email address in the end. You can email me. We will try to provide you as much as we have.
So what's the minimum preparation time required for BCPS preparation?
Minimum time for, I would say you shouldn't go that, okay, I have a 1 month and I'm going for BCPS, so I have 2 months. I must say that at least you must go to 2 to 3 times, at least from the course content, because we are not well familiar with those things, or our curriculum in the formality is not equipping us with those knowledge. So it takes us a time for, so if you are too much smart, I would say 3 months, but I would say plan it at least a year ahead, or 6 months, at least 6 months ahead. But you must gone through the exam content 3 to 4 times and practice yourself. So
Sir, how do you foresee the future of board certification, and what are the emerging trends that pharmacists should be aware of?
as I have told you that in Egypt, the board certification is considered equivalent to the MPhil program. So what I see that if there are a lot of board certified pharmacists, obviously the recognition of pharmacist would be well taken, and uh, the people, for example, if we have to hire some kind of clinical pharmacist, it's not me. It's in whole Pakistan, I would say. In whole Pakistan, if someone is a BCPS or any kind of board certification, so if he's applying for a clinical pharmacist, he would be the most appropriate candidate, and he would be the most strongest candidate to have it. But hope so. Currently, only there are just 10 pharmacists, 10 to 11 pharmacists in Pakistan. So we can't say much about it, but we hope so that today I have seen a lot of representation. So might be we have in next 1 to 2 years, there are 30, 40 more board certified pharmacists. So in next years, our role would be enhanced.
Akib wants to know how much CGPA is required for appearing in BCPS exam.
There isn't any CGP requirement. The requirement is that you must be licensed and you must have a degree. So if you have a degree, then you can go for it, or if you have a license and the experience as well.
Sir, how can we remain motivated while preparation phase, and can you relate us to some of your experiences?
How we can remain motivated? The thing is, it is a volunteer certification. So obviously you are the one who wants to enhance your knowledge. When you will be going through the exam content, you will learn daily a new thing. I assure you that you will learn daily a new thing, that okay, what is in the practice, this is the best practice, this is how it to be done. So that will help you, that will help you to keep yourself engaged. But you must see that after board certification, what would be your recognition? For example, you are just there are only just 10 board certified, 11 board certified pharmacists in Pakistan. So obviously the fruit of having this board certification would help you in advancing board certification, your recognition. So it is surely a help for you. Can you share your journey of preparing for BPS exam? I think so. I have shared my journey of preparing for BPS exam. It was quite tough job and a lot of reading and practicing.
Okay, I think we have done with all the questions. Thank you, sir, for your insightful opinions. They have provided us with a deeper understanding of the significance of board certification. Thank you for your time. Dear participants, that concludes today's session, and we hope you found this discussion insightful and it inspires you to embark on your journey towards board certification. Thank you all for your participation and attendance. We will meet again with another exciting session. For any query, you can mail us at space.farm@shifa.com.pk. See you soon in the office.
I could see some kind of questions, Sana, so I would answer it myself. Might be that's not available at your window, but let me answer those questions as well, because we have 5 minutes, so I will try to answer them quickly.
Yes, sir, you may continue, please.
Is there any case control or cohort studies type of questions? Yes, there are questions that may be asked that which kind of study it is. So research is there, and the questions are there for sure. There are questions related to that research. Sir, I'm considering finally a pharmacist, so you can please recommend something that what should we do next? Obviously, know your interest, and and after knowing the interest, increase your knowledge, increase your capacity, and review the profile of the leaders of that field. For example, if you are an industry pharmacist, so you must check that how I could get one position, make your short-term goals that and you can do it. Is monetary terms in Pakistan, which specialty among BCP and BCP should one opt for? In Pakistan, there are very few board certified pharmacists. So if you can go for anything BCPS or BCPP, I think the both would be equal. But I would say you that you shouldn't go for the monetary terms, because if you're working, if you're not dealing with the pediatric patients, and you are going to apply for a BCPP. So it's not that easy that you will pass that exam. Trust me, it's not easy. So if you're working in the pediatric pharmacy, if you're dealing with it, surely then you should go for BCPP. But if you're not working in it, so just for the monetary benefits, it would be hard for you, because it will take a lot of time for you. This lecture will be uploaded at any site or social media forum. Yes, I'm meeting and unable to listen properly. Yes, our YouTube channel would do it. How can we get your mentorship? My email would be shared. Moreover, I would say you that if you could connect with me on the LinkedIn, I would be very happy that I want to see more of the pharmacists having these kind of board certifications and doing their role. So I would suggest you to connect with me on the LinkedIn, and I will surely reply. You might be not at so quickly, but I will surely. So duration, of course. For students who have completed their MPhil, will their research year be considered as an experience year, or they will be required to obtain an additional 3 years of work experience? And actually, MPhil is not something that is related to the patient care. So if you check the eligibility, you would find that your experience must be related to the patient care. So it will not be counted. So you will have to attain those experiences as well. Recording would be available. Any other book need to go through except ACCP course outline? I would say ACCP course outline is good. That would be well enough. But if you go through some other kind of books, for example, if you're dealing with the pediatric patients, so any guideline related to those, or if you're, for example, applying for BCID, so any book related to the infectious disease, that could be helpful, or any guidelines that might be helpful. But I would say ACCP course is well enough for the exam. What is the approximate cost of the exam? That is $600. And thank you everyone for the session. I tried to answer most of the questions, and I will try to share the exam content with you via an email for all the participants who have joined us till now. So thank you everyone, and best of luck for your exam. But one thing I would say, this is my slide. This is my slide. This is the day that I want to say you that success is not what people see. It is always a result of the hard work, persistence, late night, rejection, sacrifices, discipline, criticism, doubts, failure, risks. So these all things will make you successful. So be ready for it. Obviously, the fruit is sweet, and you must accept that failure is a part during the success. So you shouldn't feel ashamed, or you shouldn't feel down if God forbid you got failed. But you should go for it, and you must be persistent enough. Thank you everyone for joining this session, and we will share the content with you soon. Allah Hafiz.
Thank you, sir, so much. That was such a great session, and thank you for your time. Okay, dear participants, we are concluding today's session. And if you have any query related to that or any other thing, you can reach us at space.form@shifa.com.pk. And yes, the session will be uploaded on our YouTube channel. So kindly check that too. See you soon. Allah Hafiz.